welcome back to the Oral Health Podcast with Karen and myself. So it is the start of National Smile Month. The theme this year is Love Your Smile. So over the next 5 weeks, we're going to be hearing and talking to a few different people who know all about what it takes to give your smile some TLC. But today we're just going to talk through the different ways that you are able to care for your smile. And as well as that, we're going to hear from Karen all the different people in the dental world that can help you care for your smile. So that's what you've got to look forward to this week. Karen, obviously, it feels like it's been ages since we
It
sat
does.
down and spoke.
I know. Well, I was thinking that myself. I was thinking, when did we last do a podcast? I've probably forgotten what I do.
If there's one thing you won't forget, it is what the roles and responsibilities are of different dental pros. So let's start at the top, or arguably, let's start at the top. With a dentist, what kind of responsibilities does a dentist have over your oral health?
Well, a dentist is there obviously to not only provide treatment, but to look after the needs of your mouth. So, when you go to the dentist, they are obviously examining your teeth. They're looking out for any issues before they actually become a big problem. They are checking the health of every part of your mouth, so your gums, the soft tissues, etc. They then can prescribe work, so they can, prescribe work for other members of the dental team to do. And the more complex work is something that a dentist would take on themselves. So a dentist is a dental surgeon, so they can do surgery as well. Many opt not to, and do the regular as a general dental practitioner. So that will be fillings, root fillings, extractions, surgical extractions if necessary, the provision of crowns, bridges, dentures. A dentist can also specialise in different areas of dentistry. So they would then do sort of courses, postgraduate courses, to enable them to specialise in different areas of dentistry. For example, you can get a gum specialist who's called a periodontologist. You can get a root filling specialist who is an endodontist. You can get a dentist who does implants, which is an implantologist. There's a theme going through this, isn't there? And then a dentist that looks after, the movement of teeth, straightening them, moving teeth into better positions, is an orthodontist. So you have to be a general dentist before you can take on a speciality. But many dentists do prefer to specialize in certain types. So some dentists do special care dentistry, so they might work with patients with more specific needs. And there are different ways. It's like anything really, isn't it? We all perhaps enjoy different parts of our job more than others, and we may decide to just sort of specialize in that kind of thing. It's like you with video and podcasting me every time I open my eyes, isn't
Quite a
it?
specific specialisation, though, isn't it, really, being a podcast host? I don't think you go to dental school mainly for that job, but I could be wrong.
No, but I mean, there are a lot of dentists who are influencers. That you see a lot of them on various social platforms. And I mean, one that springs to mind is the singing dentist. Obviously, he is quite popular,
Absolutely.
has a
Yeah.
lot of
Oh, God,
followers,
yeah.
and you know, it puts across the dental message in a way that people understand and is, entertaining. So the more we can make dentistry like that, the less sort of daunting a visit could be. So yeah, I mean, a dentist is obviously there to diagnose conditions and then arrange for the treatment. So that could be referring to a hygiene therapist, a hygienist. It could be referring to a dental nurse who has taken extra qualifications to do specific things like taking x-rays, etc. But I'll go into that more when we get to that subject. It could be referring into the hospital system if it's something that is really, really complex. So that's what your dentist is doing, is looking out for things and catching them early, such as oral cancers, when they're doing the soft tissue check. that's what they're looking out for, and they will refer you if there's any sort of worries or any concerns that they may have.
I think there's still a little bit of a grey area around what a dental therapist does that's different to a nurse or a hygienist, or how they can do some things that a dentist can, but not all of them. And so I think that would be really good if you could break it down what the responsibilities are of the other dental staff, so the nurses, hygienists, the therapists, because they do an awful lot, an awful lot.
Yeah, I mean, it used to be that the qualification as a hygienist was a standalone. Generally these days it's hygiene therapy, so they are dual qualified. So a hygienist is the person that looks after your gums predominantly, so they will be able to sort of clean any deposits of calculus or scale off on your teeth, and you polish any staining off, give you advice on your oral health, talk about your diet, etc. So they they're really, really important at keeping your gum health and preventing and maintaining gum disease. So they are the experts at gums. So when you have a dual qualification of a hygiene therapist, you have the advantage of a person who is very, very specialized in your gums and the oral health aspect of your mouth. But you've also got somebody who can do other treatment. So they can do minor fillings, they can do extractions of baby teeth, etc. That's on the prescription of a dentist. So basically what it does is it frees up the dentist's time to do the more complex work. So rather than doing the sort of less complex work that a therapist is trained to do, they can be referred to the hygiene therapist. So have a good cleaning of the gums and making sure that they're using the correct oral hygiene products. So interdental brushes, your toothbrush, they will look at the whole of your oral hygiene routine and make sure that that is the best that you can do. But also they can do these other works. So your fillings and as I say, they can extract baby teeth. So they have a really important role, and we're talking about using everybody in the dental team up to their scope of practice will actually free up time for the dentist. So whilst we're in this dental crisis where it is very, very difficult to find an NHS dentist, actually spreading the burden of the treatment that people may need is obviously going to help towards that. And that's sort of one of the big parts of the rescue plan. Won't work on its own, but it certainly will help. So it's something that we're going to see more and more. I think more therapists taking on the sort of more minor works and using the full scope of their qualifications.
Which is really important to do. These people are very, very qualified, and I think the average person, I know I was guilty of this before I really got educated on the topic, that think the dentist does absolutely everything. The dental nurse is just there to write down what the dentist is saying. And I don't think I ever encountered a hygienist or a therapist before I knew to look for them. So the more we can shout about the amazing stuff that they can do, the more they can get utilized, and then it frees up the dentist. And like you say, it's all a big snowball effect, isn't it, really?
It is, yes. And I mean, it did used to be. And I mean, certainly when I started as a dental nurse, you were the person with the tube that sucked up the spit from the mouth. It was a bit like that. However, nobody sort of delved under the surface of exactly what goes on. And a dentist doesn't work without a nurse. Many hygienists, a hygienist should have a nurse as well. Therapist needs a nurse. This is, they're all sort of ancillary staff, but the whole of the dental team is important to the practice as a whole, because it doesn't all not one doesn't work without the other. The wall starts to fall down. It's right from the receptionist, everybody has a role to play in the patient's journey through the practice, if you
Yeah,
like.
I
So
mean, the receptionists are on the front line, basically. They deal with the phones, they deal with the angry people, they deal with the people that come out and have just had all their work done and can't talk properly and still manage to get it booked in for the next appointment. And, they are very much the unsung heroes, I think, in a lot of cases.
yeah, I mean, they are on the front line. I mean, certainly when being working on reception from time to time, um, the patient can be maybe quite shouty at the receptionist, and then there's sweetness and light. If you say to them, well, you'll have to speak to the dentist about this, they go in and they speak sweetness and light to the dentist. But yeah, it's something that um you can learn to deal with. I mean, it's dealing with people, isn't it? And whenever you deal with people, there is always going to be somebody that's not 100% happy all the time, but there are ways of getting around that and dealing with complaints, which there's plenty of courses online that you can kind of learn and put yourself in a better situation. But when you look at the things that need to go on in to allow dental treatment to go on, I mean, when you think about all the instruments that a dentist and a hygiene therapist use, they have all got to be either obviously discarded if they're single use or sterilized if they're not. So you've got to have a decontamination system. A lot of practices these days have a nurse solely that is a decon nurse that works in the decontamination area and just cleans and sterilizes all the reusable metal instruments. There are also nurses that have taken extra qualifications to allow them to take x-rays, which again frees up some of the dentist's time. They can do impressions. So that's when they take a mold of somebody's mouth so they can do the study model impression, things for mouth guards, etc. So the simple, excuse me, simple sort of impression that are needed. They can apply fluoride to children's teeth, so paint that on. So there's lots of scope to go further. I mean, you can train as an oral health educator, which means that you are able to talk. So you come somewhere between a dental nurse and a hygienist. So whilst you're not sort of hands in the mouth kind of thing, you are qualified to talk to patients about their oral hygiene, the products that they use, their diet, etc. So to give them more information, again, freeing up dentist or hygienist time.
That's the route that you went down, isn't it?
That's the route I went down, yes, and I love doing that. And I have to say, I use that qualification every single day with you lot.
Yep, with me and with the other people in the PR team at Art Dental. Yeah, it's obviously come back in tenfold to
Yeah. But I mean, there are other things. I mean, again, like we were saying about the dentist before, if you have a special interest in a certain area of dentistry, as a dental nurse, you can train as an implant nurse so that you are you qualified to better assist an implantologist when they're doing their sort of complex implantology work. You can train as an orthodontic nurse. So, again, you can pick a subject that you particularly like and work within it. So there is lots of scope. I mean, you are writing up notes, you are making sure that the patient is happy, that the patient is comfortable. It's kind of you're the buffer between the clinician and the patient. Patients often find it much easier to speak to a dental nurse, and working on the helpline for as long as I did, often I would say, go and have a word with the dental nurse. They will be able to explain it to you, probably with less big words than the dentist would use, and I'm not saying that to be patronizing, but sometimes it's much easier to talk to somebody who is slightly apart from the clinical angle, and they will know what's going on because they have seen your treatment plan. So it is something very important, really. So all of those people, we've talked about the people that you are likely to see in the dental practice, and each one kind of rolls into the other one. So it's kind of like a full circle. You start with the receptionist and you end up with the receptionist, but there are people outside of the practice that you will probably never see, who are also very important to the smooth running of your treatment. So when we talk about dental technicians, a dental technician is the person that in the laboratory, which is probably nowhere near the practice, that is then going to make the item that you need for your mouth. So whether that is a denture, ranging from a denture with one tooth on it to full upper and full lower. They make crowns, bridges, the crowns that go over implants. They make mouth guards, retainers, removable orthodontic appliances. So anything that requires laboratory work will go to the dental technician. There is also another branch of that. I know I'm probably ramming you with loads and loads of information here, but a clinical dental technician can actually take the impression to make your denture. Now,
Bit of a one-stop shop.
Yeah, one-stop shop. Yes, if you don't want to visit the dentist, if you have no teeth at all, if you have none of your natural teeth, you can visit a clinical dental technician and they can make you your full set of dentures. However, if you have some of your own teeth, you will have to visit a dentist first and get what's called a certificate of oral health. So basically, you'll have to have a checkup to say that you don't have any other treatment outstanding. Then the clinical dental technician can make your partial denture. So that is somebody else that you should bear in mind when you're sort of looking for treatment. If you, for example, if you break a denture, you could just take it to a dental technician to see if they can fix it for you. But equally, you could take it to the dentist and they'll send it off for you.
I have to say as well, the dental technicians, like, that is what I am fascinated by personally. I follow so many on Instagram, on my own account, not even on the foundation's account, just me, Sophie, because they are like artists. They are like, they're artists. They're doing art on such a microscopic scale. Because, like, I had a conversation with a dental technician you'll hear later in the month, but like they made the point of, if it doesn't look good, people won't want to wear it. They take it so seriously, and it's such an incredible craft that I am absolutely fascinated by it personally.
But when you think about having a crown, so for example, if you were having a crown at the front of your mouth, that technician has never seen the rest of your teeth. So they have to be led by the dentist taking the shade and any markings on the tooth so that that crown matches the rest of your teeth. And so they're working blind to a degree. So the dentist has to be really, really good at taking the shade and any kind of markings that they might want in there to make the tooth look as natural as possible. So that it's not sticking out like a sore thumb. Because if you or I made it, we'd probably go, yeah, well, teeth are white,
Like it was made of
aren't they?
Play-Doh if I tried it. You know what I mean? Like, it would not be good.
Yeah, I mean, and that is a thing on its own, isn't it? Looking at, I've got to make this thing and I've got to make it to match the rest of the teeth, but I can't see the rest of the teeth. So it is quite a skill. It is a skill. So yeah, I think there are a wide range of people that kind of work in there and in your dental care that you may not automatically think about because you don't always see them. However, gone are the days where it is just the dentist and that's all anybody used to think about. I think that we've made massive strides into using and utilizing everybody's each unique skill. Many people don't want to be a dentist. Many people don't want that kind of huge responsibility because it's like, you've got somebody's life in your hands almost, haven't you? Because you've got, there are lots of things that could go wrong, but don't go wrong because, people are very skilled. And, you know, I've always tried to persuade my son to be a dentist, but he's far too squeamish. So no, that wasn't going to happen. So
But there's one person we haven't mentioned, Karen, and that is the most important person that can help you take care of your teeth, and that is yourself. Because at the end of the day, it all comes down to what you do at home. It all comes down to what you do to manage your own health at home, because no one knows your mouth better than you do, apart from maybe a
absolutely.
dentist.
Absolutely. I mean, I used to work for a dentist that used to say to children, now, only brush the teeth that you want to keep.
That's what it comes down to, really, isn't it?
And I think that is really good because you do, I mean, over the years, I've had people saying, well, it's not my responsibility. And it is the responsibility. You know, the mouth is part of the body, and we take responsibility for other parts of our bodies. You know, we don't willingly use our arm to, you know, shut a door or whatever, but we will use our teeth as a tool and, you know, wonder why they chip and things like that. So yes, it was, I mean, it's hugely important to brush your teeth, but you know, they have their own particular job, and they can't do it unless you are on board with, you know, making sure that you eat the right food, you effectively brush them, you clean incidentally, and you are hopefully visiting your dental team regularly.
Absolutely. And, you know, we'll, like I say, hear from a few different members of the dental team over the next couple of days and weeks. And we've got loads more things planned throughout Smile Month that I really hope you're going to enjoy, because I think it's going to be a good one. I think it's going to be a good one this
I
year.
think so.
I
I
love
think
the
so.
subject matter, and
We've
it'll,
got we've got some
yeah.
great things coming up, and I think that you know, when we speak to real people doing real jobs, and we can, you know, get people to know what their person is doing, then I think it makes it all the more exciting. But you know, we've got so many different weeks and so many different subtitles that come under Love Your Smile, and we just want to bring it back to ourselves that it's our smile. We need to take ownership of it, and you know, treat it as it would like to be treated, really.
Absolutely, absolutely. And so I'm going to leave you be for now, Karen, and I hope that you guys have enjoyed listening. And yeah, I hope that, you know, the next time you go for your checkup at the dentist, maybe you look around the room and see the other people that aren't the dentist, and just appreciate them for all the hard work they do as well.
They would love that.